Okay, welcome back. This is our sixth video, the third one dealing with conventional snapshot 12-lead ECG, a 10-second long recording. This ECG is from a very young patient. It's from a 14-year-old male that we've named Kent C. Long. Again, that's not a real name. It is a descriptive name. And this young man had a syncopal episode, so he passed out and was brought to the hospital. And this was his conventional ECG. He had regained consciousness in the meantime, brought in by his parents. And this is showing essentially a normal ECG. It shows a sinus bradycardia, heart rate of 58, and it's read by the automated call as normal. This is from a major manufacturer machine. And if we look at the ECG more carefully, I don't see really anything abnormal. The intervals are all okay, the axes are okay, the voltage looks okay. There may be a flipped T wave in lead 3, but that's a non-specific finding. And so all in all, we have a normal conventional ECG. Let's go ahead and look at the advanced ECG. Again, we're going to start with our fiducial points, as we always do, to make sure that those are in the correct locations. The P beginning and end and peak, and the QRS beginning and peak and end, and the T wave peak and end. And those all look very good to me. So we will trust where our fiducial points are. Let's look over at advanced ECG now. We're going to start with the signal averaging and loops, and we notice right away that there is a minor abnormality in the spatial QRST angle, the peaks angle. The mean angle is also a little bit borderline there as well, 65. Let's go and look at the loops. Those look okay to me. I don't see any obvious abnormalities that would indicate a structural problem. The frontal and horizontal and left sagittal loops look within normal ranges. There's a bit of space between the QRS max vectors and the T max vectors, especially in the middle plane and the left sagittal, but nothing too big. Let's go and see the complexity as well, and we're looking here at the T wave complexity. We do have one abnormality in the ratios that we calculate from those singular values. So that's maybe a very minor abnormality in T wave complexity, although QRS wave complexity is normal. But let's go back and look at our 3D ECG again, and we notice we do have one other abnormality, and that's the spatial JT peak interval, which is 274 milliseconds. That's abnormal. That can be easily derived just by taking the spatial QT interval, as we see here, 467, subtracting out both the spatial QRS duration, 87, and the spatial T peak, Tn. And if you do that, you end up with 274 milliseconds, which is elevated. A normal value in any healthy subject should be less than about 268. And in a male in his second decade of life, should be less than 265. So that 274 value is much greater than 2 standard deviations above the mean for healthy people, and also abnormal in terms of medians. So we do have an abnormal spatial JT peak interval. We have a borderline spatial QRST angle, peaks angle, and we also have some minor abnormalities in T wave complexity. Let's just go back to the scalar ECG, again, just to show folks the spatial JT peak. So you start at the J point, beginning of the ST segment or end of the QRS, and go to the peak of the T. So that's the interval that's prolonged. It's actually a more important interval than the T peak Tn. The T peak Tn is especially useful so you can derive the JT peak. So we have an abnormal spatial JT peak, and his heart rate's about 60, so the JT peak corrected interval is about the same. Going back again then and summarizing, borderline abnormal spatial peaks, QRST angle. We have a definitively abnormal spatial JT peak interval and borderline T wave complexity. And just a quick look at that JT peak again using our fiducial points. You can see that that's abnormal. You can calculate that out. So this combination of abnormalities, we're not sure what the underlying pathology is, but we should be able to find that out from our statistics, which comes in the next video. To